Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers. Hi, everybody. Welcome back to another episode of Carolina Functional Neurology Center's podcast. We are launching a spinoff of What Did the Patient Say called What Did the Doctors Say? And we're going to do an open discussion forum. This week is going to be about concussion discussion. And we have three experts here in the field, all with different backgrounds, that are going to talk about the things that they want you all to know about concussion. So I'll go ahead and introduce our panel and then we'll get started. First, we have Dr. Fran Meredith. Fran is a functional medicine provider in North Carolina since 2017. She used to provide primary care and infectious disease expertise in the Triangle for over 20 years. At Stribling Springs Wellness, she sees patients with complex, chronic, multi-system illnesses. Her passion for concussion care blossomed, and she created My Concussion Doctor and the first of its kind acute concussion intervention powder blend called Concussion 911. Fran, thank you for joining us.
Thank you, Dana. Happy to be here.
I'm so glad. And Dr. Sandra Farnham. Dr. Farnham has practiced medical optometry since 2005 and joined Advanced Family Eye Care and Sightwork Vision Therapy in Denver, North Carolina in 2016 to focus on her passion as a behavioral optometrist. She enjoys practicing full scope medical optometry for all ages with a special love for patients with strabismus, amblyopia, and learning disabilities, along with brain injury and rehabilitation for all ages. And last but not least, our very own Dr. Lynn Carlson. Dr. Carlson is a board-certified chiropractic neurologist currently practicing at Carolina Functional Neurology Center in our Charlotte location. She's been serving on the faculty of the Carrick Institute since 2009 and has enjoyed collaborating in the education and training of other providers. So welcome, doctors. We really appreciate you guys spending the time and being here with us. We're going to kind of kick off with a little bit of an icebreaker. And so in the world of concussion, we know that there can be a lot of misconceptions or myths about concussion. So I would love all of you to chime in and just have an open discussion about what is maybe one of those top myths or misconceptions that you hear kind of in the field or from your patients that you want to clear up and you want people to know?
There's many of them, actually. I think we would all agree right off the top, the old myth that you have to hit your head to have a concussion. We know that that's no longer true. So that is important to understand. You don't have to actually hit your head to have a concussion is one that I want to make sure people really remember and understand, because the mechanism of injury in a concussion, there has to be, plausible biomechanics, or there has to be enough forces generated to create some of those shearing and tension forces within the nervous system that affects the axons of the nerves. But that doesn't necessarily mean you have to be at a high velocity car impact. You can get a concussion in sports, we know, from slip and falls, but there does need to be enough forces to actually generate a concussion injury. Because I would say one of the misnomers I see with patients often is they come in and maybe they had a concussion before, so they have a very heightened sense towards concussion awareness, and now they might go over a speed bump or there's something that jars them and they think they had another concussion. And that isn't enough of a plausible biomechanical mechanism to have that as a second concussion, but it does set off that neurometabolic cascade or inflammatory cascade that can happen if they've had a previous concussion. So that's just an important distinction. You don't have to hit your head. It can be any kind of jarring force, rotational and shearing forces are some of the worst to actually generate the concussion damage that we see.
I think probably for us, it is, I can read the 20/20 line and my images, my MRI or CT scan are normal. So I'm okay. But yet they struggle with everything that they do.
I think for me, the misconception is that this is only focused around athletes and sports. And we know that that's actually a minority. That's only 14% of the people that have concussion are from sports. So it's the rest of us, right? It's that whiplash, as Dr. Carlson was mentioning. It's that whiplash that they might not have thought was significant. So it's slip and fall, motor vehicle accidents. There's so many others, and also chemicals can create the equivalent of a concussion. I can attest to that myself because I had one. So the scope of the people that we're after in terms of reaching for education is so much broader than just athletics.
Yeah, that's a very good point, Dr. Meredith, because in even military, we know that there's blast injuries where they weren't directly hit by anything. It's just a blast wave that can still create the effects of a concussion. So certainly there's so many different ways where you can have a combination. There can be overlapping symptoms as well. You can have a concussion and a whiplash, which we see often with like a car accident, and they are overlapping and sometimes confounding one another. And that's why with concussion, we know that it has many subtypes. Some people have more damage in the vestibular ocular type of pathways where their eye tracking may be off or their balance may be off. Maybe they have the neck pain associated with that whiplash as well. So you can see so many different things. And you know the saying, right? When you've seen one concussion, you've seen one concussion. You can't do across the board comparisons because everyone's brain is so unique and different that however their brain was before this injury plays into how their prognosis and recovery is going to be moving forward. With the vestibular ocular in particular, there's oftentimes that, as you're saying, Dr. Farnham, the inability to read. I mean, maybe they can see a 20/20 line on a Snellen eye chart, but yet functionally moving their eyes in a coordinated way to track things in their visual world is a big thing. We see so much of that with the diagnostic that we do. We have the goggles where we can actually see their eye tracking. So you literally can see where they're having faulty ocular mechanics. And it's no wonder they're getting headaches or they're feeling nauseated or having symptoms because of the eye component, the visual component.
Right. They have trouble reading, they have trouble driving, they have trouble just going through the day, and their fatigue is pretty severe as well. Also, to add on to that, after infections, we see a lot of patients who get a chronic inflammatory response, and then they have the same type symptoms after strep infection or COVID infection, something like that.
Yeah, so we're certainly seeing a lot of that too, is the post-infectious. Anything can get worse after those infections. And one of the other important myths or thoughts I think I would like to say is sometimes a patient will come and they say, I have a concussion. And I say, when was your injury? And they'll say 5 years ago. So there is that, they want to still be saying, I have a concussion, whereas technically the concussion has a neurometabolic cascade that happens in about 72 hours to 3 days. So the damage is really being done in those 72 hours where you're getting that inflammatory response. You're trying to get into that healing mode. And anything beyond that is what we used to call post-concussion syndrome. And now the most recent best practice guidelines are saying, let's call that what it is, persistent concussion symptoms. So it's really not a post-concussive syndrome. We're shying away from that language and more towards persistent concussion symptoms because they do persist. So the symptoms are what are presenting for someone, although they're not having a concussion in that moment. It's been 6 months, a year, or more beyond.
That leads me to another misconception that I think we need to clear up right away, that we all know because we see this every day, is that concussion is not just a traumatic brain injury, but a total body injury. And that, gets into some of the chronic symptoms that can be there 5 years later, whether it's leaky gut or it triggered your autoimmunity or your hormones are out of whack. So we call it total body injury, TBI. And then the other piece of that you guys all know is it's not just doesn't just affect that person. We're now using the term TFI, total family injury, because the repercussions in terms of caregiving and lost income and mood disorders and marriages breaking up and not being able to take care of your children, it affects the family and the community. Yeah. So people just don't realize that unless they've lived it.
Oh, yeah. I like that, TFI and T, the body, because there are, with those domains of injury, there is that mental emotional. So sometimes people think they're just depressed, or why do I all of a sudden have anxiety? And they aren't normally anxious people, but they get diagnosed with that post-concussively quite often because there's an emotional mental health component to that, especially when it goes on for months and years and the family's affected.
Yeah.
So it's very real.
I actually just saw a new patient who just walked out of my office to see me for functional medicine with Stribling Springs Wellness. And of course, I peel back the layers and create a timeline for her. And well, her anxiety depression started when she was 18. What happened in the 2 years before that? Oh yeah, I had a concussion. Okay, let's peel this onion back and go back to the root cause. So that will certainly be a cause of her anxiety, depression, and likely her autoimmunity, which she just found out about with me. So
yeah. So
I mean, that's so true. I have strong feelings about that when a young person comes in and they've been diagnosed with all these things. And when you do a timeline-based history, as you're speaking to, you really can see that there's this pattern. And then when COVID came along, you just see that whole inflammatory response kick up so much that it is more of a total body type of injury, as if they had a concussion along the way, for sure.
Where do you guys think the disconnect is that, we find so often in functional healthcare where, like you said, Dr. Meredith, it was when she was 18, right? Fast forward how many years later, and she's now in your office. Where do you guys all see the disconnect in your own practices? This injury happened a long time ago, and now we're having to peel back the layers of the onion because they didn't get in front of somebody that they needed to, or they didn't have the information. Just interested in your guys' take on that.
Coming from the traditional allopathic world, we weren't taught anything about this. Well, we weren't taught about root cause, right, at all. So we weren't taught to look back in the timeline. So most people who have had a head injury, most of them don't see a doctor, first of all. But if they do see a doctor or provider, the information they were given was the information I was taught, which was nothing, which was the old-fashioned, rest, no screens, you'll be fine in a few weeks. Hope and pray. Well, we now know that the, rest, hope, and pray, it doesn't work for a lot of people. So whether they saw someone or not, they did not get cutting-edge information.
Mm-hmm. Yeah.
And along with that too is more of that myth is people will say that their MRI or CAT scan was normal, so they don't have a concussion, and that's not accurate because a concussion is a functional disorder. It's a disconnection in some of the circuitry, and it's not going to show up on MRI or CAT scan unless there's been another pathology or ablative type of injury. So just because they've had imaging, if they even did present to the emergency department, because you're right, Dr. Meredith, a lot of people never get diagnosed because they never go to seek care because they think they just got their bell rung and it'll go away, and they just wait it out and attribute a lot of their other signs and symptoms to something else, like, oh, my stomach's acting up or I'm feeling nervous, and not bringing it back to that injury.
Yeah. And they get their eyes checked because they feel like they can't see, they can't focus, they can't remember, they can't read, everything is off, they can't drive in their car, scrolling on a computer screen. So maybe they do seek care and they're 20/20, their eyes are healthy on the inside, and either the parents are being told everything's fine, the adults being told you're fine, maybe use these glasses for presbyopia. And so there is a disconnect in the patient being evaluated and the providers knowing what to do, because sometimes, the eye doctors even might recognize something, but then they don't go the next step in sending. And so there's barriers to even getting to where people need to be.
Dr. Farnham, what just popped out of your mouth, it makes me realize that so many people with concussion fall into the same bucket that folks with autoimmunity fall into, which is they're seen once, you look fine, look at my finger, you're fine, right? So they're told again and again, you're fine, fine. Oh, honey, it's all in your head. Take some Prozac. And then they stop seeking care. They're sick of being told it's all in their head. And yes, it is in their head, right? But it's also in all of these other systems, their vestibular, their vagus nerve, their visual systems, their gut, their hormones, all of it. But it's not just in their head, but they've retreated because they've been told so many times, honey, it's all in your head.
You're fine. Yeah. Nothing shows.
Yeah.
We
Dr.
pulled,
Farnham.
oh, sorry, Dr. Carlson. I was just going to say we pulled some of our followers to ask some questions. And I thought that this would be a good time to interject with this question as you guys are talking about this, because somebody asked if they sustained a concussion or they suspect that they had a concussion, when should they get checked out and why should they get checked out?
They should get checked. I mean, I think, of course, medical care comes first. Do they have a bleed? Be checked by a medical provider. And then, usually a couple weeks. Doesn't mean they're going to go into therapy after a couple weeks, but get a baseline, see what needs to be followed. And then, based on what you find, follow up. But in another month, sometimes we do nothing. Sometimes we give glasses just to aid symptoms. It doesn't have to be a prescription. It can be something over the counter. Again, our goal is a functional goal, having them function at their best. And typically that is no glasses, be back to how they were, but sometimes they need some tools to help them get there. So anything that we prescribe or give them is going to have a goal of temporary use until they rehabilitate. So for example, if they're seeing double, we don't give them glasses to compensate for the double vision. We give them a functional lens to help them in a position where they can fix whatever the reason that they're seeing double, so that eventually they come out of it. But any tool you can give them early on to help them rehabilitate it on their own, along with all the other multidisciplinary teams. So sooner than better, to answer your question.
Yeah, I think they should be managed and followed. And I will give the sports community credit because there are consensus statements for athletes. So there are best practice guidelines specific for sports participation. So typically an athletic trainer might be following them if it's a sporting concussion. And there's questionnaires, right? We know those questionnaires where there's 23 symptoms. So even if they're just filling out those symptoms and watching to see if the symptoms are getting worse or getting better, especially in that 3-day window, is usually the time frame that we're looking at. The first 3 days are key to watch that neurometabolic cascade. And if things are progressing, they should be under management and evaluation of some kind of healthcare professional. So the athletic trainers know to watch for that and send to usually an allopathic medical provider as a primary tier to get them assessed if there's anything else that has to be done in terms of imaging or further watching. But for us, we see the function deficits that can be there months, years later, but we can still see it. So having someone who's on your team that can see it for what it is, and then direct you appropriately, whether it's vision therapy or pharmaceuticals or nutraceuticals or whatever you need to do to balance out that neuroinflammatory response is important.
I feel like the other piece of that you guys have been in this field, in the concussion field, longer than I have. I got kind of thrown into it headlong with a family member, but I just think that people are not going to get an adequate assessment of all of these pieces, all of the total body injury, from a traditional allopathic doctor like I was. We are simply not trained in it. So I believe that we are now on the cutting edge of being able to provide this information grassroots, not just to athletes, but woman with a 92-year-old father who might fall. I might fall on the ice. So having people know that, and I'll get into this in a minute, there is now an acute intervention that is available that addresses the metabolic cascade. People need to know that tool exists for them now and is evidence-based. But I feel like the next generation ought to be increasing awareness that you, Dr. Farnham, and you, Dr. Carlson, exist, and that you guys have the ability to do frontline assessments that really look at all of these body systems. And there are online practices that also do online assessments for the first 90 days. There's several of them we have been working with that can do the testing and create the initial neuro rehab, like in the first 2 weeks, 4 weeks, 6 weeks, within the first 90 days. That is a great first line option for people to be able to access. Then if they get beyond 90 days, then Dr. Carlson, they absolutely need you. And the testing will determine if they need you, Dr. Farnham. So I think that we're at the front end of really being able to educate at a grassroots level.
Mhm.
Well said. That is great, because there's that other question that I know I've been asked many times is, what should I take? What supplements? Like there's some magic supplement that will stop the concussion. So now you're on the forefront of looking at that metabolic side, because literally it's that brain on fire that is causing a lot of the symptoms. And managing that's an important consideration. And what you get is a young person who maybe doesn't have enough sleep. Their diet is really not the greatest, lots of sugar, lots of caffeine or energy drinks. They get a concussion and their metabolic terrain is already so pro-inflammatory for their lifestyle that now the concussion ramifications are greater than someone who has adequate sleep and a good diet. So it's a real important thing for patients to understand and take responsibility for, is that neurometabolic side of what's going on with them.
I work with a chiropractor neurofeedback expert, Dr. Barrick, and we came about the way to address the metabolic cascade purely in a brainstorming session. My son in 2023 had a huge concussion and knocked him off his MLS soccer tryouts pathway. And so we just sat down and said, well, somebody must have addressed this neuroinflammatory brain on fire. Someone must have made something like this. And no one had. We looked it up, 2 years ago online, and here are the 12 bottles of things you need to be taking. Okay, my kid's not going to do that. So that led to hundreds of hours of research and all of the things that lots of people are very familiar with, omega-3 fish oils and ketones and vitamin D. And for me, the bells go off when I talk to people and just bring the inflammatory cascade, the metabolic cascade, into light in very simple terms. It's very easy for people to understand. If I just tell people, okay, step one, your brain needs energy. You no longer can transport glucose into your brain. So all of the daily work of business of your brain can no longer happen. So inflammation, you need that to deal with an injury, but it builds and you can't get rid of it. Toxins, they build and you can't get rid of it. So we need a backup generator, step one. So backup generator, if glucose doesn't work, ketones, magic, backup generator. And then we've got all sorts of things, the vitamin D, the curcumin, the omega-3s to help with the inflammation, and also things to help with the toxin buildup, things like N-acetylcysteine and some magnesium and vitamin C and acetylcholine, all of the things to help those pathways. So we're excited because we're seeing it working. We're seeing it just drastically shorten recovery courses. So we're just trying to jump from the rooftops and yell how can we put up a billboard on the highway instead of everybody knows what to do with a heart attack, right? Or a stroke, because they've seen it on a billboard. No one thinks they have any tools in their hands if they or a family member bump their head. So, and that may decrease your business. Dr. Carlson, sorry about that, but hopefully then fewer people actually have to move into the chronic neuro rehab.
Well, I was just going to say, I'm assuming you're treating brand new differently than year old. Yeah.
Yes,
and probably post-infectious versus traumatic. Is that correct? Different.
Correct. We're on the front end at this point, and we really are focusing on traumatic and early. So, would it help a year later? Maybe. Can we say that? No, we can't yet. That's down the road, right? With trials, but we know from our patients that we've used it so far on that it's doing what we hoped it would. Theory is reality.
Yeah. And this is a powder, Dr. Meredith? It's a drink
powder?
Powder?
Yes, it's a powder. It tastes good. We figured out a way to hide fish and NAC and ketones. They all taste horrible. So it tastes good. You mix it in with water. and 3 times a day for 14 days. So our most recent one was actually 2 weeks ago. One of my patients / friends texted me on a Sunday about 4:00 and said, "I just picked up my daughter Anna from church camp, and she had a concussion yesterday. She's nauseated. She has a headache. She's tired. She's irritable." She said, "I wish I had some of your," what did she say? Potion. "I wish I had some of your potion." So luckily she lives close by. So she drove over to my house that night, and her daughter got on it that night. So that was about 36 hours after the hit. And next day, within 72 hours of starting it, her nausea was gone. By 3 days on the product, her headaches were almost gone. She was able to start to look at screens again. By day 5 to 6 after injury, her symptoms were gone, completely gone. And that's pretty fast. And this is a 13-year-old kid, right? They do bounce back quickly, and she's a healthy kid. But from nausea, headaches, can't look at screen, can't function without a nap for more than an hour or two, to birthday party, watching a movie, full-on schoolwork within a week. Yeah. So we're pretty sure, we're pretty happy that it's having that impact.
And are you tracking that through symptoms mainly, or also pairing that with any objective exam?
That was purely symptoms. Yeah. Yeah.
Nice.
We had another question about testing, and kind of to your point, Dr. Carlson. So, as functional providers, we talk a lot to people about how, symptoms are usually the last thing to present and the first thing to go away. And we want to make sure that some of these objective measures are improving, right? So that we're not, quote unquote, sending somebody back onto the field when, they seem okay, but maybe there are still some underlying functional pathologies that need to be addressed. Obviously, when people can function, 5 days after an injury and not have any symptoms, that's great. And for the athletes, like we talked about earlier, right, they have impact testing. And, there's some controversy around the testing itself as well, right, because they know how to cheat the system a little bit, right, so that when the injury is sustained, the injury doesn't look as bad and they can go back to doing what they love to do. Us lay people out here just living our lives, we don't have any baseline testing. And we always talk to our patients about, you only get one brain, right? Everybody knows what to do with a heart attack, but they don't know what to do when their brain is injured. So I think, like Dr. Meredith said, getting that information out there is appropriate. But I'd be interested to know, from all of your different lenses, what do you guys recommend as like some sort of baseline testing for those people that don't have impact testing, that just are trying to be healthy, have a functioning brain, and know if there's some sort of issue? Like, are there options out there? Do you guys have different options within your individual professions? Or do you guys have a wish list that you wish was out there that everybody could get tested, either from a lab perspective, or from an eye exam, or from functional neurology exam? Just really interested to see what your thoughts are on that.
Yeah, well, where there's a need, there is, we have to create something. So that's where having the diagnostics are the gold standard. And balance has always been considered a gold standard of neurological function. So simply being able to do a balance assessment, and you can do it in athletics, they do it right at courtside or at the side of the field. Athletic trainer can have them stand feet together. But what's most important, I think, is to use these metrics in the baseline so you know what their normal function is. Do it in a way that they can't. That's called sandbagging it, what you're describing, where they kind of purposefully don't do as well. So doing it in a way that you can't really fake balance. That's something that is pretty objective. That's why it's a gold standard, and involves multiple systems. So balance involves proprioception, your eyes closed, so it's taking away the visual. You can do it with different turn positions to involve how the neck is working on different surfaces. So balance is one of my favorite, along with eye tracking. There's been different bedside or courtside tests for eye tracking, like you probably know King Vivek. The CODs, because if there's a change in how quickly someone can move their eyes, that's a very strong metric that something's going on in your brain. Absolutely. So eye function, balance, any eye-hand reaction time are considered very much gold standards to come up with the diagnosis of probable concussion.
Wouldn't that be lovely if those things were taught to allopathic doctors like myself who are supposed to be doing a physical exam every year? That would be lovely if that were incorporated as a part of our just regular person yearly assessment, so that when we bonk our head, we've got a baseline. That would be lovely.
Yeah, baselines are key. And exactly to your point, Dr. Farnham, you're saying someone's 20/20 on Snellen eye chart, but there's a functional loss. So that next step of making the referral to a functional practitioner, that's where our dialogue amongst ourselves as interdisciplinary practitioners here is to then, who do they need to go see? How can we work together to make sure it's a best approach for that patient and a team approach? Because
Yes.
they need to see it.
Yes, I agree with you. Eye movements are huge. It's something that a lot of practitioners don't look at. But in addition to that is eye posture, meaning how your forehead, how you're pointing your eyes. Are you pointing in front of the target, behind the target? And it's very common to have a vertical misalignment, very, very slight. Sometimes the patient is not even seeing double, but that vertical misalignment is not tolerated well by the brain. And so movement, dizziness, sometimes shadowing that they interpret as blur is all from a vertical misalignment, and it is missed repeatedly in just a routine eye exam that is not looking at eye posture. They're just looking at acuity and eye health. So again, eye movements, but also eye posture, invergent skills.
Absolutely. That eye posturing is so key. Those heterotropias. Big takeaway for me is if a patient starts saying that they feel worse when they go into like a big store that has a lot of aisles or vertical stacking of shelves, that environment, or in a car, they now have this car motion sensitivity. When they get those vertical misalignments of the eyes, it's very hard for them to just be in a visually demanding environment. And we live in a visually demanding world. So it's so exhausting for their brain to try to have to cope with that visual misalignment on top of the inflammatory that's happening in their brain. And they get exhausted. No wonder they're fatigued and want to sleep all day.
And sometimes it's not even a true visual misalignment. It is a, like you said, motion processing problem. Our peripheral vision detects motion. It tells us where things are located. So if you're not using your peripheral vision, you're just honing in centrally. You don't know where to look, and you can't move your eyes. So it's really a peripheral problem manifesting as a phoria or vertical misalignment.
Yeah, which is why we spoke to this a little bit. People start chasing their symptoms. They'll go to the eye doctor thinking they need new glasses. They'll go to the psychiatrist thinking they need anxiety meds. They'll go, do some fad diet because they think their digestion's off, and they are just piecemealing it. And there's not that cohesiveness in a functional approach to guide them through the recovery.
Yeah. When vision is off, again, I'm biased, but when vision is off, it's guiding and leading everything you're doing. And so just everything becomes uncomfortable. And then you get the anxiety from being uncomfortable socially and driving a car and shopping.
Yeah, exactly. And one of the old school things, as you mentioned, Dr. Meredith, was to tell people to stay in a dark room and cocoon and not be exposed to stimulus. And that's now known to not be the best for brain. But you have to have a graded progressive. You can't just say, go out, start shopping. There needs to be some game plan. So that's where the guidance and, care management is so important. As you're mentioning, they need glasses to help them stabilize to then they can get out of those assistive glasses, or we need to have a plan to expose them within their metabolic capacity so that they don't get that migraine headache or get triggered in a nauseated state and count.
And then they're in bed for a week.
Right. So 2 steps forward and a whole bunch of steps back when you over exceed that threshold. Yes, sure.
In that example that was given with Dr. Meredith's patient, is there anything specific that you guys would say, okay, we've cleared what we think is this acute neurometabolic cascade of a concussion in a few days with Concussion 911 is what the supplement's called, correct?
Correct.
Okay, so we've cured it. We've gotten rid of it. The patient is asymptomatic. In your opinion, Dr. Meredith, in your opinion, Dr. Farnham, and you, Dr. Carlson, is there something that you would want that patient to know? Okay, 13 years old, want to return to school, want to return to sports, want to return to, do they still go to the IMAX theater or whatever it is, go shopping at Target? Is there a lap is there a lab test that you would want to run on that patient, Dr. Meredith, to say, okay, you feel good, you look good, we're making sure you're good? Or Dr. Farnham, do you think that they should come in and have some sort of visual posturing test? Or, I'm sure what Lynn will say, but, is there something functional neurologically that they should have tested to say, okay, we have a new baseline for you, right? And I think this is so important, especially for young women, small necks, they're cheerleaders, they're in gymnastics, they're doing all kinds of stuff, right? What's the baseline, and what are maybe some general quick tests that people should be getting to make sure that they're good? God forbid they have another injury or a first injury.
I do think that there needs to be follow-up, really, no matter what age, whether it's 6, 13, 42, 60. I think there does need to be new baseline evaluation. And obviously not everyone's going to do that. They're going to say, does my insurance cover that? Maybe not, right? So that's an impediment. Hopefully in the future, we can figure out a way for that not to be an impediment and for that to be standard of care, to have a new baseline that incorporates some of the tests we talked about before. I know there are some blood tests, and Dr. Carlson, you probably can bring them up off your brain. I can't bring them up as quickly as you can, but there are blood tests that do evaluate the blood-brain barrier, right? That if I had the opportunity to do some of this testing within 6, 12, 48 hours of this little girl hitting her head, I'm sure I'd see evidence of blood-brain barrier disruption. I certainly would like to see that go away, that lab marker resolve. But is that in most people's budget, and is it now available to everyone? No, not really, but future, we can hope, right? I think the other thing I just want to make sure, we alluded to this earlier in terms of, your brain after one hit is set up to really do poorly the next time. And it's not if, it's when, because systems remain out of alignment and increase the chance that you're going to get another, chance that you're going to have a musculoskeletal injury, and that, I think that increase persists for at least 3 years. So to let people know, again, there now is an acute metabolic intervention. We have acute concussion intervention. So if you've hit your head once, you need to be prepared for the not if, but when. So that have a tiny little supply of this concussion 911 in your pantry, so that should you or a loved one hit your head, you're prepared with at least 3 days worth of it, then you can order more. But my hope is that, again, with this collaborative approach and grassroots education, get a new baseline test, be prepared for the next time, and know that there will be a next time, and make sure that people are aware that their risk is higher going forward, and they don't just sit and do nothing. They now have an arrow in their quiver.
Mm-hmm. That is so important. I really resonate with that word baseline, because even in that person you described, that becomes her new status. That is her baseline if we can retest her. But the metrics for that, and it is a very real thing, does my insurance cover it, is one of the first questions we get. But to make it accessible and affordable, because we all know this, someone, say, take an average 15-year-old, they will know their blood pressure numbers, they'll know their cholesterol numbers, they'll know their blood sugar or hemoglobin A1C numbers, but do they know their eye-hand reaction time? Do they know their visual tracking scores? Do they know their balance and postural stability scores? They don't, because it's not considered the normal screening, when we need to make that more of the normal conversation. Brain health has metrics that we can mark. Your medicine cabinet should have concussion 911, just like it has Band-Aids, just like it has whatever else you would use for an injury. So having a baseline, and we are working towards that, having the use of technology. So there is technology now that you can do at home that looks at your balance, your cognitive, neurocognitive aspects, as well as, memory, everything like that. So you can see for yourself where you are. You can retake it anytime you're not feeling great, and those scores can go to your provider, and we can monitor people remotely. So that is where we're going with things. And I think that's a service that has to be affordable for people, that they can wrap their brain around. Okay, I can do that. It's not cost prohibitive, and it's engaging them to be active participants.
Yeah. For us, it would be basically a comprehensive eye exam can include the things that are important, like your, maybe not a score on an automated test, but look at the eye movements, measure your depth perception, your eye posture, and some versions. It's quick. It can be done. The patient probably just has to ask for it and make sure the provider, it's something we're all taught, so it can be done.
So they can just go to their regular optometrist and ask for those tests.
Yes, they should. Yeah, most of them. Now, it's not something typically done in a routine exam, but it could be asked for, and most providers are aware of how to do them. And a lot of them might say, no, I don't do that, and would be able to send to someone. But again,
And can
knowing what to ask.
one more time, because I think that's a really easy thing for people who have a concussion, and a lot of people go to the eye doctor regularly, whether they have a prescription or not, to just get their eyes checked out. They don't realize how much of a window it is to their brain function. So what are those 3 things you said they should be asking for?
Eye movements,
Depth
perception,
perception,
eye posture, and vergence.
eye posture, and vergence. Okay, you guys heard it here first. Now you know. If you've had a previous head injury and you get a little bump, go get those things checked out. If you actually hit your head, also go get those things checked out.
Absolutely.
All right. Well, we are running short on time. This has been a great discussion. I want to give you each the floor for about a minute to just say, again, who you are, where patients can find you, your website, if you have any social media content that you want to share. And anything else, kind of last quick note that you want to let everybody know. Dr. Farnham, if you want to take the floor first, go ahead.
So I practice behavior and vision rehab at Sightwork Vision Therapy Clinic, and it's considered Stanley, but it's in Denver, and routine comprehensive eye exams, which can include all of those measurements at Advanced Family Eye Care. We do have our Sightwork website is sightwork at just sightwork.com.
Great. Thank you. Dr. Meredith?
So I wear a few hats. So part of my time is spent as a functional medicine provider at Stribling Springs Wellness. And then part of my time is really promoting education, concussion education and awareness. So through my concussion doctor, and part of that is trying to increase the awareness that now exists in acute intervention, to have in your athletic bag, in your pantry, so that someone in your family, either you or someone in your family, has this small fire extinguisher in their pantry and knows how to pull the pin. So you can put out the fire in the kitchen before it spreads to the whole house, total body injury, because we can't really move out of our house, our body. So we need to have someone, that's the goal. So we have a lot of educational material on myconcussiondoctor.com, and we're also on Instagram and TikTok and all that stuff. So there's a lot of things there. And the Concussion 911 is available on Amazon and on our website.
Great. Thank you. And Dr. Carlson?
I'm a board certified chiropractic neurologist, so that means I'm looking at holistic approaches in a functional neurological way. So we do comprehensive exams to look at all of these systems we spoke about, and including, the chiropractic side of me is looking at the spinal relationships and neck and that as well. So we kind of do that full body approach, not just brain, because that's important. And there's so much information on our website. It's carolinafnc.com. So Carolina Functional Neurology Center, I'm in the Charlotte office location, but carolinafnc.com has, we have videos, patient case studies, and lots of information about anyone with any type of complex neurological disorder, including concussion.
Awesome. Well, thank you all for joining us for kind of this kickoff of the What Did the Doctors Say concussion discussion. We appreciate all your time, and we will provide everybody with, again, kind of your full-length bios and your websites and any social media that you want, so that when they watch this video, we'll share that kind of below for them to click on and find you all. We really appreciate it. Again, these discussions are always driven by our followers and everybody that chimes in online about the information that they want to know about their health. So if you're watching this and you don't follow us online, please follow us at Carolina Functional Neurology Center. This will be up on YouTube as well as Apple Podcasts, and we will give it to Dr. Farnham and Dr. Meredith to share on their social medias as well. Thank you all.
Thank you.
Thank you.
Thank you.
Bye, everyone.